The COVID-19 curve in the U.S. is rising again after months of decline, with the number of new cases per day doubling over just the past 3 weeks. It's being driven by the fast-spreading Delta variant, lagging vaccination rates, and those 4th of July gatherings. Joining me now is Dr. Cedric Dark, assistant professor at Baylor College of Medicine and board member with Doctors for America. Dr. Dark, it's always good to see you. Dare I say, do you believe that at least pockets of the country have entered yet another wave of COVID-19?
There are certainly some pockets of the country that are seeing the potential for a fourth wave right now. I can speak specifically about Houston. Some of our most recent numbers are actually quite troubling. The warning signs are there. We're seeing cases actually go up 199% week to week here in the Houston area. We're seeing that the positivity rate has gone up about 29%. The reproduction rate of the virus has gone up 76%, and hospitalizations are going up 14% here in Houston locally.
Those are really troubling numbers, Doctor, and thanks for mapping that out for us there in Houston. So of the people who are getting sick, of the people who are being hospitalized, are most of them, if not all of them, unvaccinated, or are you now seeing those fully vaccinated now getting the virus and getting this Delta variant as well?
The vast majority of people that are becoming infected now, especially the severe cases, are unvaccinated people. And so that's something that everyone that's watching this program should know is your best protection against COVID remains vaccination. Second best protection is wearing a mask when you're out and about town.
You know, speaking of which, the getting a vaccine, not getting a vaccine has become highly politicized. And I just want to highlight Tennessee right now, which actually is saying that they're going to stop, I guess, halting all communication with younger people to get vaccinated. There was an effort there to get people aged 12 to 18 vaccinated, and authorities there are actually halting all of those efforts. Why do you think that is? And especially in a state like Tennessee, where I believe the vaccination rate is quite low right now.
Well, I don't want to speculate as to why that is, but I would like to tell you what the consequences are of firing your top vaccine expert and then telling your Department of Health to stop outreach to young people. Because right now, even though we've seen good things like the vaccination rate in 65-year-olds among above 76% across the country, what we see amongst young people, people below age 40, is fewer than half are vaccinated, no matter what their age demographic is. What's going on right now in Tennessee is atrocious. It is reprehensible. And what they're actually doing is actively working against science and actively working against public health, because they are saying that they are not allowed to hold events in schools, that they're not allowed to have direct outreach towards young people. And what we're going to see, not only this for COVID, this also applies to all other childhood preventable vaccinations. So think about all the things that we've done in public health. We have eradicated smallpox. We've eradicated polio in the United States. That's through vaccination. We also have seen the morbidity or mortality from other childhood diseases like measles, Haemophilus influenza decline to almost disappear in places where people have vaccinated enough of their children to achieve herd immunity. And we can do the same thing with COVID-19 if we put forth the effort. We can also cure things like cervical cancer by vaccinating children with the HPV vaccine. But not only is Tennessee getting rid of their outreach for COVID vaccination, they're getting rid of their outreach for all these other vaccine preventable illnesses as well.
Right. And I think that is an excellent point, because the politics around vaccines that began with COVID-19 now seem to be spreading to other vaccines, even including the flu vaccine. What do you think the short-term ramifications might be? Could we see a spike in flu cases this coming fall and winter if people start to shun that vaccine? Then we'd have to deal with the COVID-19 situation and a very aggressive flu season.
Well, I mean, the evidence is pretty clear that by adopting the protocols that we did during COVID-19 mitigation, especially wearing masks and sort of social distancing, we eliminated flu in certain parts of the world where they were having their flu season, like Southern Hemisphere during last summer. And we will undoubtedly see increasing cases of flu this year simply because we've gotten rid of a lot of those mitigation measures. But what's most concerning to me is not really the flu. It's not even COVID sometimes at this point. It's that we're going to take a step backwards scientifically and medically because we are allowing vaccine people that don't believe in vaccines to run this debate that's happening. And it's not a debate, it's science. What we need to have people doing is vaccinating their children against all of the ordinary childhood vaccinations. And there's an element in our society that is anti-vax, and they're being very strongly heard right now. And they're using COVID purely as a means to an end.
I want to get your take on something the White House has been doing a lot of, and that is tapping some star power to get people to go get these vaccinations. Today, pop star Olivia Rodrigo is at the White House meeting with President Biden and Dr. Anthony Fauci. I believe she's making some highlight videos for young people to get vaccinated, and she's going to answer their questions about the shots. What do you think about efforts like that? And should we be seeing more of that, maybe not even at the federal level, but at the more local level throughout the country?
I would love to see more young people, more people from Black and brown communities talking about getting vaccinated. We know that people are more trustworthy when they hear from their physicians than listening to politicians about the vaccination. Whether or not it extends to celebrities, hopefully it will. And if we can have celebrities communicate, especially with healthcare workers, about the benefits of vaccination and reach people that may be hesitant towards it, not folks necessarily that are outright antagonistic towards vaccination. Hopefully that can help us get past this pandemic.
With new cases now on the rise and the Delta variant now the dominant variant in this country, what would you say to people who are making plans to actively travel, perhaps for leisure or for business in the coming weeks, people who are going to be going to gatherings throughout the summer? What would your message be to those people?
Do it while you're vaccinated. If you want to travel, that's fine. I just got back from a trip to Arizona. My wife and I were vaccinated. Our son, who's under 12, is not vaccinated, but he was wearing a mask everywhere that we went because that's the safest way for you to interact with people. And, I'm not, as a physician, going to tell you to stay stuck in your home at this point in time because we do have good countermeasures for this pandemic. We do have solutions for it. And what I would like to say is if you are going to have a gathering, make sure that everyone in your gathering is vaccinated. If you're able to do it outside, if the weather is nice, go ahead and enjoy the fresh air and do it that way just to minimize your risk. The thing to avoid is areas where people are potentially unvaccinated, where you're in enclosed spaces with poor ventilation, because then your risk will run higher. So at this point, difficult to do, and I would avoid those types of activities, especially if you can't confirm that your cruise line is going to require 100% vaccination policy.
Right. And it seems like those policies are being written as we speak. Dr. Cedric Dark, assistant professor at Baylor College of Medicine and board member with Doctors for America. Thanks so much for being with us today.